This is a PCA, so this is patient-controlled analgesia. So this is where you're going to hook up something that's going to go through the IV so the patient can control their own amount of medication to help them get through surgery or whatever it is that they've got that they have pain with. The first thing you want to do is check your batteries. So it takes 4 AA batteries. A lot of times, especially on our unit, we don't use them as often, so the batteries are no good. If you need to replace the batteries, you need to replace all 4. Don't just do one and think, oh, maybe it's just that one. Just go ahead and do all 4. It has a little program of, you can see which ones go up, which ones go down. So just follow the little schematic you can see in there. And then it just has this little lock right here. Okay. And then you're going to go ahead and turn your medication pump on. So it's right on the side there. And then it should do this nice little CAD Solus. And it'll say, do you want to start a new patient? So yes, you do. Then it's going to ask you for your key code, and your key code is 447. I think everybody has the same, right? Yeah. So you're going to go ahead and use your select keys. So you're going to go to 4, and then you're going to hit select. Then you're going to go to 4 and select, and then you're going to go to 7 and select. Okay. So then it should tell you what is it that you want to do. And you're going to go, yes, you want an IV PCA. It's going to tell you standard concentration. Most of the time, there's 3 different medications that you can use with a PCA. I have to say the most common is probably the hydromorphone, which is Dilaudid PCA. And so you're going to need to go get the cassette out of the MAR. You're going to make sure that that's what you want. Occasionally, they do want a morphine one. Once in a while, a Demerol, although I believe that we're, for the most part, not doing Demerol anymore. It's one of those contraindicated drugs. So for the most part, it's usually hydromorphone. So you're going to look at your cassette, which sorry, I don't have a cassette because I can't pull one out right now. But it's usually going to be 0.2, but you're going to check that concentration on your cassette, and that's what it should say. You're going to go ahead and hit select. You're going to do OK, and you're going to say yes. Standard concentration is 0.2. So it's going to program that into it. And then you're going to want to go ahead and review your pump settings. Review. So you hit review, and then you go to continuous rate. Since this is a PCA, there's no continuous rate. Now, once in a while, the doctor will order a continuous rate, but it's usually 0. So you're going to want to say continuous rate 0. And you're going to go ahead and select that. And this is where you can go up, go down with your scroll keys. I don't want to, so I want to go ahead and save that. And you're going to go to your next select thing. So you're going to go ahead and scroll down. This is your PCA dose. So that's going to be whatever the doctor has ordered, okay? And it can be anesthesia, or it can be your physician that maybe has done your surgery. So again, you're going to go up. You're going to go up there. You're going to hit select. And what's your dose going to be? Let's